Hello from the beautiful shops at Merrick Park. Dr. Soler-Baillo here. Today, two things. One, if you were paying attention before, I'd like to let you know that we did get some new orchids. So, got that one out of the way. The other one is a very common topic. I like to call it Botox, eyeshadow, and poker. And what do all these three things have in common? Most women today, as soon as they see a wrinkle, they run off, they'll grab their Groupon, and they'll go see whoever's doing Botox that week for a very cheap price. So what happens? As women age and they try to put on their eyeshadow, they start having a problem. And they start needing a third hand, a different technique, but it becomes problematic because the skin just over the lid becomes a little bit loose and it's a lot harder to apply the eyeshadow. So they go get all this Botox, enough to win a poker game because they have no expression at this point. They're not analyzed properly, so their brow drops and makes the problem worse. So how do you fix this? Well, number one, you need somebody who's honest and knows what they're doing and doesn't just Botox you to Botox you. But most importantly, you analyze the eyelid, because if you Botox significantly, you're gonna drop that brow and make the eyelid problem worse. Being a plastic surgeon, it gives me the opportunity to assess you properly and decide whether a blepharoplasty or removing a little bit of that skin or the upper lid, which is a wonderful thing to do, makes you look better. They do say the eyes are the windows to the soul. And the second thing it does, it lets you be much more aggressive with a Botox so you can go out and win that poker championship. So here's a perfect example of a young woman who started developing bags under the eyes and a heavy eyelid. In her case, I performed an upper lid blepharoplasty and I took out fat from the central compartment in the upper lid and from 3 compartments in the lower lid. I did the lower lid through a trans-conjunctival approach, which means there's no scars on the outside. We just take it out from the inside. And I did some fat grafting right to the tear trough to improve that transition. So the overall look is refreshed, not surgical, and very, very natural. So she can have all the Botox she wants right now, look very smooth, and still be able to put her eyeshadow on. Until next time, from the shops at Merrick Park, Dr. Soler-Baillo.